Good afternoon. Good afternoon, everyone. My name is Ranjit Walia, and I'm the past chair of the board of directors here at the hospital. I'd like to thank everyone for being here today. It is great to see so many of the Markham Stouffville Hospital staff, physicians and midwives here, as well as other special guests from the ministry and our board. Mike, thanks for coming. We have had the pleasure of welcoming Minister Jaczek to the hospital on several occasions. And some of us even joke that you probably know your way around here more than me, maybe. You are a familiar face to many of our staff and have been a great supporter of the hospital. We're happy to have you here on any day, but we're especially happy to have you here today when you bring good news. We were delighted to learn of your appointment as the Minister of Health and Long-Term Care. You bring to this portfolio a wealth of knowledge and perspective, and we know that you deeply care about the health of all Ontarians and the overall sustainability of the system. We're also fortunate to have you as our MPP for Oak Ridge, Markham. Mr. Jaczek, may I request you to please say a few words.
Well, thank you so much, Ranjit. And of course, I couldn't be more excited to be here than this occasion. It's just wonderful for me as the new Minister of Health. It's 2 months today since I became the Minister of Health, to be here in Markham Stouffville Hospital with all of you for what I hope will be a very exciting announcement. I know many of you have worked towards this day for quite some time. And so it really is a wonderful privilege for me to be here with all of you and to first of all say to all the health professionals here, all of you who are part of an amazing team, we in Ontario are so lucky to have the dedicated health professionals we have. We truly have a world-class healthcare system in this province. I needed to remind the legislature of that in question period this morning, because we really do. And not only of course, do we have technology and all the sort of physical pieces that we need, but really it boils down to the people who serve Ontarians in their hour of need. And I had the experience just recently. My husband was in South Lake for 6 days, and I saw how hard people were working. And I also saw that we have more work to do, and I will freely acknowledge that in terms of ensuring that Ontarians have the staffing they need in all our healthcare institutions, and that they have the type of facility that is up to date and what we would expect. So I am here to ensure that you know that we appreciate the team here. Joanne Marr has been someone I've known for many, many years in many of her previous positions, a wonderfully experienced CEO for this hospital. The board, having just talked to a few members of the board, this hospital board, I think, is second to none in terms of the dedication to the community that's served. And what can we say about our foundation at Markham Stouffville? You know, you all know Alan Bell, I'm sure, and I'm sure we wish everyone well on their trek to base camp in Everest. And we know that that is all being done on behalf of this community to ensure that our facility here at Markham Stouffville is absolutely second to none. I especially want to recognize all the midwives here today. When I first heard of this project, before I became minister, obviously some time ago from Joanne, I was really impressed by the model that has been developed here. Because, as you hopefully all know, I am a physician, and I was trained a long time ago. And physicians tend to have, certainly those who are trained like I was in the 70s, kind of a physician bias towards the role of midwives. And you have done such an excellent job here in Ontario. I mean, you're now delivering 16% of all births. The deliveries through midwife services, whether it be at home, at a birthing center. This is remarkable. You have absolutely convinced the old-fashioned me that this is the best care for patients in terms of the type of work you do, in terms of the prenatal, the antenatal, obviously the delivery, the postnatal, the type of support you give is absolutely second to none. And so I do want to specifically recognize your association of midwives as well. I've met Kelly and I met Christine, who are part of that association, and I am really impressed with the way midwifery has progressed in Ontario, serving so many residents. And I also want to recognize the Central Lynn. I don't see Kim Baker here, but I know that the Local Health Integration Network has been promoting this particular unit that we're here to announce today, and have really helped to devise a model that obviously we as the Ministry of Health are so pleased to endorse. So I want to ensure that you understand that over the last number of years, our government has been working with the Midwives Association, with individual birthing centres, to ensure that we increase the percentage of births through midwifery from that 16%. We are absolutely committed to increasing the number of births through your services. And so we've been opening new midwifery practice groups across the province every year. And so to date, some 87 hospitals across Ontario do offer midwifery care. We opened up 2 birthing centres, and it is a model that has been working very well in our largest urban centres. Obviously, you know, it's Toronto and Ottawa, and we're having great success with those. We also started the Indigenous midwifery program, hiring specially trained Indigenous midwives to provide culturally appropriate care to Indigenous families in 5 communities so far across the province. And I'm sure we have lots more work to do in those communities. Having visited a number of fly-in communities in the north in my previous role as Minister of Community and Social Services, there's tremendous scope for the practice of midwifery. I've also visited Six Nations in Brantford and seen the wonderful unit that they have down on that Six Nations reserve. So I'm here today to formally announce that our government has been continuing to work with midwives and families so that even more families in our province can access the compassionate, skilled care that midwives provide. So I'm pleased to announce that the Ontario government is supporting the opening of a new midwifery unit here at Markham Stouffville Hospital. So the new alongside midwifery unit will be midwife-led and offer labour, birth and in-hospital postpartum care to over 1,000 more families over the next 5 years. And so this is really an exciting investment in Markham Stouffville Hospital, but this is just one part of our government's plan to expand access to care from midwives for families in this province. When Joanne first told me about the alongside nature of this particular unit, she told me how well the team was working together. In other words, OBS, GYN, midwives, anesthesiology, everybody was fully dedicated to the best care of the patient. There was no, or as little turf issue as there possibly could be in terms of the proposal and the work that had gone into designing this particular unit. And I was extremely impressed about that. So, across the province, Ontario is supporting for the first time innovative models of midwifery care that will offer more options to families to access the care of a midwife in more healthcare settings than ever before. So it will include team-based healthcare groups and clinics, such as your local doctor's office, community health centres, and more hospitals. And on the subject of community health centres, many of you know in York Region we have really not had community health centres. What's one over in Vaughan, but there is a real real move to increase, and actually I think that's tomorrow's announcement. But anyway, you can be here at community health centres, as you know, as a model of care using interprofessional teams. And again, I am a great fan of that particular model. And so, of course, there will be more hospital midwife-based services as well. And so these new care models will start in Hamilton, Delhi, spelt like Delhi in India, but you say Delhi. It's a very rural community. Used to be kind of the tobacco capital of Ontario down in southwestern Ontario. So I was quite intrigued. You've got an urban centre like Hamilton, then you've got a centre of a very rural community in Delhi. Ottawa, Thunder Bay, Brampton, Collingwood, and Toronto. And so this is just the beginning. And because of this expansion, an additional 700 families this year will be able to access the care of a midwife in their community. So the government is also welcoming 82, I love the precision of the bureaucrats, 82 new midwifery graduates into practice over the course of the next year. This will allow over 600 additional families to access midwifery care in their communities. In addition, our government is creating 3 new midwifery practice groups this year in the west part of the Greater Toronto area, which is apparently lacking in sort of the Brampton, Mississauga area. So this will provide access to midwifery care to another 655 families. And finally, Ontario is expanding the Indigenous midwifery program to Elliott Lake and Toronto so that another 190 Indigenous families can access culturally safe care when they are expecting a child and all the way throughout the pregnancy and postpartum journey. And so I'm pleased to announce that because of all these new investments across the province, over 6,700 more families will be able to access the care of a midwife this year compared to last year. So that's quite a number, if you think, 6,700. And that will then bring us to a grand total of over 30,000 families this year who will be able to access midwifery care. So I want to thank the Association of Ontario Midwives for working with us to achieve this exciting accomplishment together. And I look forward to continuing to work with you. It's 2 weeks, but it might be longer. Let's hope so. So I hope to work with you, whether it be through having a home birth or accessing midwifery care through individuals' local hospitals, because expanding access to midwifery care is part of Ontario's plan to create fairness and opportunity for all families across the province. And this is why we're making other investments in terms of families. So you hopefully will have heard that we're making childcare free for parents of kindergarten-age children, 2.5 years old and over. And it's why we made college and university tuition free for low-income families. And this is why we're making the largest single investment in mental health care in Canada's history. We know that families need more care and more support, not less. All of these initiatives are part of a broader strategy for fairness and opportunity and to build a strong, healthy province that is supported and cared for. And so I'm truly proud to be part of a government that is making these kinds of important investments in our families. And I want to thank you all for all the work you do each and every day to support the residents of our community. Thank you so much.
Thank you, Minister, for your ongoing commitment to patients and families right across the province. Your leadership in this area will be felt within the families and the community for years to come. Thank you. Joanne, would you like to come and say a few words, please?
Thank you, Ranjit, and thank you, Minister Jaczek. As Ranjit said, you've been a tremendous advocate and supporter of our hospital and for healthcare right across the province, and that's certainly well known. As you know, hospital leaders aren't short on great ideas, and the team here is no exception. A few years ago, the team started talking about a midwifery unit here in the hospital, and where some may see obstacles, this team saw nothing but opportunity. I think for something like this, of this magnitude, to be successful, you need champions. Those who drive the initiative, the ones who keep it alive no matter what, generate the excitement, maintain the momentum, and always keep the end goals in mind. And in our case, we had 3 people like that. I'd like to give thanks to Barb Steed, our Executive Vice President of Clinical Programs and Chief Practice Officer, who happens to be out trekking now and isn't here with us today. Cheryl Osborne, the Patient Care Director in our Childbirth and Children's Services program, and Carol Cameron, Executive Director of the AMU. And of course, there was a supporting cast of many, many others who worked with them, many of whom are here today in the room. Together, I think you were a force to be reckoned with, and I'm so delighted that you've brought your vision to reality. I'd also like to point out just how much collaboration is necessary for something like this to be successful, and you heard the minister speak about this. Our obstetricians and our midwives have had an excellent working relationship historically, and I really believe it's because of that it's uniquely positioned our hospital for this innovative concept that we're so proud of. And it's a real tribute to everyone involved and your commitment to the patients and those we serve. I'm truly excited about what this means for our hospital, but also for our community. We're so proud to be the first hospital to have a standalone midwifery unit right within our walls. It gives patients the choice when it comes to their birthing experience, and I think this signals a true partnership with patients at the center, which is such an important ingredient in a patient-focused environment. There's tremendous work being done just a few floors up from where we are right now, and we're excited that we're going to soon start to see patients. And so, Minister, on behalf of the team here today and all the women and the families who are going to benefit from this wonderful announcement, I want to say thank you. Thank you for allowing Markham Stouffville Hospital to be a leader in this area, and thank you for your support in making it happen. I know we've talked about it for quite a long time. We're hoping that you'll come back soon and you can meet some of our new babies. In the meantime, we've, as you see, we've set up some items that will actually be used in the new unit, so we encourage everyone to have a look. Now, has Kelly arrived? Okay. Oh, hi, Elizabeth. Did you want to say a few words on behalf of Kelly? So Kelly Stadelbauer is the Executive Director of the Ontario Association of Midwives, a midwife herself, and I think we're going to have remarks on her behalf. So welcome. Come on up.
Hi, everybody. I'm Elizabeth Brandeis. I'm the president of the Association of Ontario Midwives and a midwife in Toronto. Thank you, Minister Jaczek. Your funding announcement today is certainly very good news for the new and expectant families in Ontario and right here at Markham Stouffville Hospital. As you noted, this funding will expand Ontario's access to midwifery care. This announcement means an additional 2,500 clients, not just at Markham, but all over the province. Each year will be able to access this kind of care during pregnancy, labor, and the postpartum period that they want and that they choose. Midwives are so proud that they're a growing presence in Ontario. As community-based providers with a commitment to keeping birth as normal as possible, as a physiological event, midwives know that they make a difference in the life of their clients and know that they're making a difference in shaping the healthcare system of the future. We're so pleased with this announcement today and also growing the profession in general. We've been especially pleased that your work with the ministry and through the association have done to renew and support the restoration of Indigenous midwifery as well. Today's announcement also includes, outside of this hospital, providing culturally safe pregnancy and newborn care to communities in Indigenous communities. We applaud the ministry's important investment here. The Association of Ontario Midwives is certain that there will be a tremendous return on the investment for all families. I'm going to cut this a little bit short because we have a lot to say about a lot of things other than the hospital, but we really do open up the possibility for new innovative models here and all over the province, with Markham Stouffville Hospital leading this innovation. Markham Stouffville Hospital has recognized the high-quality maternal newborn care that midwives provide in this community and is introducing this midwife-led birth center that will offer labor, birth, and in-hospital postpartum support for low-risk clients, their newborns, and their families right here in these walls. We'd like to thank you for recognizing the need for this kind of innovation in perinatal care, and thank you for your continued investment in midwifery and midwives and supporting the families who choose to birth here. I'd also like to congratulate the midwives. I know how long this has been in coming, and the CEO of the hospital, Joanne Marr, and her staff and team here at Markham Stouffville for launching this innovative model of midwifery care. I've been particularly impressed over the last 2 years with the vision, dedication, and perseverance of the midwives here to get this project off the ground. So I'm looking at you, Carol. I know how much blood, sweat, and tears you've been putting into this. So on behalf of the board and staff of the Association of Ontario Midwives, we wish you all the greatest success in this exciting new venture. Thank you.
Thank you, Minister Jaczek, Joanne, Elizabeth. Your enthusiasm and commitment is recognized by all in this room, and I'm sure it'll benefit everyone in the community and in the province. I'd like everyone to stay, have a few refreshments, take a look at what we have here, and thanks so much for coming.